although gastric banding is a relatively safe procedure and is well tolerated. However, it is associated with few complications which include gastric prolapse, band slippage, band erosion and complications related to tubing and port. Moreover, failure to lose significant weight is also reported more, as compared to other bariatric procedures. Acute gastric prolapse is the most common emergent complication that requires emergent reoperation. Acute severe pain, with dysphagia, vomiting, inability to tolerate oral food is the typical presentation. Anterior or posterior gastric prolapse may occur. The initial evaluation is done by obtaining plain abdominal X-ray. If the band is in horizontal position instead of its normal oblique position, then prolapse must be strongly suspected. Initial treatment is to remove all the fluid from the system. This often allows reduction of prolapse and resolution of symptoms. If symptoms do not resolve after this, an upper GI series is indicated. If prolapse persists, then laparoscopic reoperation is required to reduce the prolapse and resuture the band in place. Chronic gastric prolapse is subtle. Band erosion is uncommon, reported in 1 to 2% patients. The patient usually develops port site infection or systemic fever. Endoscopy can be diagnostic. Presence of free air on CORT scan should alert the surgeon. Laparoscopic removal of band is indicated, with repair of gastric perforation. Port and tubing problems are reported in at least 5 to 15%, and require revision of port and tubing system.